Hello, my name is Jules Amader, and I am the Medical Director of the High-Risk GI Cancers Clinic at the Huntsman Cancer Institute and an Assistant Professor of Medicine in the Division of Gastroenterology and Hepatology at the University of Utah. Thank you to the editors of Gastroenterology for the opportunity to present a video abstract of our study entitled Characteristics of Missed or Interval Colorectal Cancer and Patient Survival, a population-based study. Colorectal cancer is the third most common cancer in the United States and the second leading cause of cancer-related mortality in men and women. Colonoscopy has quickly become the preferred option for colorectal cancer screening in the United States. It is hypothesized that most colorectal cancers diagnosed within 5 years after an index colonoscopy are owing to missed lesions or new interval cancer development. The tumors have been varyingly referred to as missed, interval, or post-colonoscopy colorectal cancer. The few large population-based studies that have evaluated the risk and predictors of interval colorectal cancers at colonoscopy have reported rates as high as 14%. However, most of these studies are from countries with healthcare systems that differ from the United States or in restricted populations and thus may not be generalizable to the U.S. population or routine clinical practice. The aim of the current study was to assess the proportion, characteristics, and predictors of interval colorectal cancers occurring within 5 years of colonoscopy in a large population-based study from Utah, which reflects usual clinical care in the United States. We performed a population-based retrospective cohort study of residents in the state of Utah between 50 and 80 years of age who underwent colonoscopy between February 15, 1995 and January 31, 2009 at the University of Utah Healthcare, which includes Huntsman Cancer Institute, or at Intermountain Healthcare. Together, these health systems provide care to more than 85% of the Utah population. The Utah Population Database was then used to merge de-identified medical information on these colonoscopy patients with cancer diagnoses from the statewide Utah Cancer Registry. We defined interval colorectal cancers as cases in which a colonoscopy was performed between 6 and 60 months before colorectal cancer diagnosis and detected colorectal cancers as those diagnosed within 6 months of a colonoscopy. The following study flow diagram shows the number of patients undergoing colonoscopy and developing a detected or interval colorectal cancer. In total, 126,851 unique individuals received a colonoscopy during our study timeframe at either Intermountain Healthcare or the University of Utah Health System. After merging with the Utah Cancer Registry, 2,659 patients were found to have developed colorectal cancer within 60 months of colonoscopy. Of these, 2,500 patients had a colonoscopy within 6 months of CRC diagnosis and were classified as detected colorectal cancer. A total of 159 individuals had a colonoscopy 6 to 60 months before the colorectal cancer diagnosis and are referred to as interval cancers. Thus, 6% of all colorectal cancers were interval cancers. Patients with interval colorectal cancer were older, nearly 4.5-fold more likely to be over the age of 65 compared to colonoscopy patients without a diagnosis of colorectal cancer. As you can see in this table, compared to patients with a detected colorectal cancer diagnosis, interval cancer showed a strong association with proximal colon site with an odds ratio of 2.24, which was statistically significant. They were also nearly 3 times more common in patients who had an adenoma, as seen in this table, and 2-fold more common in those with an advanced villus adenoma found at their index colonoscopy, as seen here. A family history of colorectal cancer in a first-degree relative was also more common in patients with an interval cancer compared to those with a detected colorectal cancer, with an odds ratio of 2.27 that was statistically significant. We were able to complete a medical chart review on 36 patients with an interval colorectal cancer at one of the 2 health systems. From this review, we found that 30% had a report of incomplete polypectomy and 57% of patients had a polyp removed in the same segment of the colon in which their interval cancer was located later. Cecal intubation and adequacy of bowel preparation was present in 92% of patients. In Kaplan-Meier survival analysis seen here, we see a distinct survival advantage or a lower risk of death for interval colorectal cancer patients compared with detected colorectal cancer patients across all cancer stages. The overall hazard ratio is 0.63 and is statistically significant. This population-based study from Utah comprises colonoscopy data from a large academic medical center and a managed care organization that together provide care to greater than 85% of the state residents and thus represents usual clinical care. We found that up to 6% of colorectal cancers were missed at colonoscopy. This rate is similar to that reported in prior studies. Similar to prior studies, we found a majority of interval cancers were located in the proximal colon. We also found that a prior history of polypectomy was a significant risk factor associated with interval colorectal cancer development. This may represent a segment of the population who are polyp formers or raises the issue of incomplete polyp removal. Having a family history of colorectal cancer was also a significant risk factor and may reflect differences in tumor biology. This also emphasizes the importance of taking a thorough family history. Take-home points for physicians include: we identified several factors such as older age, presence of adenomas or villus adenomas at index colonoscopy, and a family history of colorectal cancer that can be used by physicians to stratify the risk of interval cancer in their patients. If colonoscopy is to reduce the burden of colorectal cancer to the maximum extent, further research is needed to understand the causes of missed cancers and improve polyp detection and polyp removal. Thank you for your attention.